Hello. In reflecting on the articles, I believe that one of the most important steps that can be taken in supporting or minimizing, I guess I should say, the stigma of towards mental health of African American communities, but then also of any young men or women who would otherwise maybe be seeking care, is the importance of um, more realistic portrayals of symptomatic characters in media, whether it be film or television or whatever medium it may be. And the article spends some time on this, but in in speaking on more realistic portrayals of individuals with mental health disorders, because when I personally think about how mental health is often portrayed, it's these grand sweeping dramatic highs and lows of depression, of anxiety disorders, of schizophrenia, of bipolar disorder, and it's typically played for drama and it's played for suspense. Um, and whether or not, because in most movies where that's kind of what the point of the movie is to have those mental health conversations, a lot of the time it does end in successful treatment, or at least or managing symptoms, and so it does kind of end on that realistic note. But the thing that sticks with audiences is the dramatic valleys kind of that experience. And I think when we talk about realistic portrayals, I would love to see more characters who are just in symptom management for any number of mental health disorders, and they're not ignoring the fact that there's highs and lows, um, and Keeley lows, but that it's shown in a more normative light of this individual is experiencing symptoms, but they're in active management, and it's just kind of it's not what the story maybe is about in whatever medium it may be in, but it's just kind of a truth, a fact of like that individual's arc in some respect. Um, and then regarding the development of conduct disorder, um, our readings talk a lot about um, the some there are some genetic and biological factors that come into play that are especially worsened if symptoms become evident in childhood rather than adolescence. The younger that symptoms start, um, or some of these maladaptive behaviors become present, typically the worse outcomes are, and the more prevalent conduct disorders become or remain through the lifetime. And then they can be exacerbated by several risk factors, individual temperament, um, access to supportive environments. The biggest factor that our text discuss, both the DSM and the clinical assessment handbook, is the importance of the parental role of that immediate environment throughout childhood and adolescence, and parental neglect, abuse, uh, psychopathy on the part of parents and guardians, um, in that immediate sort of nurturing environment or unnurturing environment, has kind of some of the biggest impacts on the risk or protection of individuals who maybe already have some genetic predispositions to conduct disorder. Um, and that moving forward, like speaking on interventions, like that's clearly informed by many intervention styles that do focus very specifically on um, trying to protect the child's environment, um, specifically through different parent training, um, trying to build up their parental systems to be able to have more support and offer some of those more protective factors within the home. Multisystemic theory is one, or therapy, excuse me, is one key way to be able to do this. Um, Trying to retrain individuals in the home and build some, utilizing their intrapersonal systems as well and the resources that they bring to the table. Um, and then also functional family therapy, working to replace some of the specific maladaptive behaviors that the child is experiencing, while also supporting the positive ones. And then on a one-to-one basis, the most effective clinical um, tool is typically CBT therapy, specifically helpful with aggression as well.